Hello everybody. Today it will be something different. Now I'm in oncology clinic and this is Dr. Berry, and we will talk a bit about medicine. How is it in USA? So first question, all this disease, it's not easy stuff, and when you realize that a patient have something really dangerous and mortal, with whom you talk first? With him or with relatives?
So it depends on the situation. If the patient is alert, coherent, understanding, and you can actually communicate with them regardless of the age, you prefer to speak to the patient and many times with the family together. Sometimes we have a situation where the family is afraid that the patient is too fragile emotionally and they cannot handle this news, especially an older person with other medical problems. And in those situations, we'll let the family know first because they know the patient, and we'll tell them, we have to tell the patient, we're obligated to tell the patient. But sometimes the family will be with us in the room and help us in that process because they know how to talk to their relative better. But normally we always like to get everyone involved at the same time. So in a room like this, it's like a living room. We will have the patient, the family, everyone present when we go over the diagnoses, the prognosis, the plan, the therapy, the side effects of the therapy, any questions that they have. We like to do it so that everyone hears the same thing.
And it means anyway patient will know a prognosis. Yeah.
Yes.
Because in Russia, by the law, doctors have to tell, but actually sometimes they don't talk with patient about it.
You have to always put the patient's health first. And the patient's health, sometimes in addition to physical, means mental health. So when you get to know a patient and you know if they're a little weak emotionally and what they can or can't handle, you must tell them the truth. You cannot withhold information, but the method in which you deliver the news and how you say it, and in some instances, if you want to try to leave them with a little hope, if you're going to try to treat this, that's where the art comes in. So, for medicine, there's a science and there's an art. The science is the easy part. That's very black and white, and you can read exactly what you need to do. The art is what you get with experience. How to speak to patients, how to give them bad news.
Do you have a special education for?
This is something that and I believe it's very important throughout the world for medical schools to now start incorporating communication skills. There are many brilliant doctors out there that don't have the ability to communicate. And patients will say, he did a very good job at treating my blood pressure, my heart disease, my cancer, but I cannot talk to him, or he just comes in for 2 minutes and he just tells the information and goes. And when you're dealing with problems like we deal with cancer, you cannot have that relationship. You have to have the patient's confidence, the patient's trust, the patient's understanding. If I see a patient and they're starting chemo, they always will have my cell phone. Because if they feel sick, if they're not feeling well, if they're scared about something, I know them, I should talk to them. If the doctor who's covering speaks to them, sometimes they won't be able to give them the best advice for the patient, or they'll just say, go to the emergency room. And many times when the doctor that knows the patient best speaks to them, they can help that situation out a lot better. Plus, the patient has more confident hearing from the doctor that knows them better. So they don't have training, but I believe as medicine evolves, if you really want to deliver proper care, the communication skills are very important, and that's something that has to happen in the future.
Yes, I think we have a big problems in our country about it. You can nearly don't speak with your doctor. He come, check, and go write papers.
Yeah.
And that's all.
Yeah, the writing and the documentation in this country is very important because if you don't do that from a legal point of view, you can have problems. And I'm not going to minimize that. That's important. But it's also when I'm in this room seeing a patient for the very first time, the laptop, the computer over there, my assistant, there's a girl, a navigator, she's doing all the typing. I just sit, I look at the patient in the eye to develop a relationship so they can just feel like we're having a conversation. You don't want it to be sterile and clinical and you're just typing and you're not bonding with the patient. That's a very important. It is that moment where the patient develops some comfort and some confidence in you, or they become more nervous and apprehensive. And for oncology, for cancer, that is very bad. The patient's needs have to be first and foremost, and you have to go. You have to work extra hard to make sure that they're comfortable. You do the documentation. I finish my paperwork afterwards. When I leave here, then I sit at the computer, and what she's typed, I fix it, and I add my own words and my own plan. And it takes a little longer, but the patient leaves feeling much better.
Oh, thank you. What about covering this type of medical care of insurance?
Yeah.
Is it a problem? Some people, they are not covered for
Yes.
this case?
So unfortunately, the delivery of our services and healthcare has become more and more and more expensive. Some of the medicine that we use for cancer care costs thousands, more than $10,000 a month for pills, and without insurance, it can be a problem. But I say with a lot of pride that we have different methods. If someone is underinsured, they have less insurance, or if they have no insurance, there are many different ways that we're still able to get them what they need. For example, if I need to infuse a very expensive medicine, the hospital has a charity care program for those patients that cannot afford insurance, where they get the drugs for free. Most of the pharmaceutical companies, for the very expensive pills, they have programs. The patient has to fill out paperwork, and then they'll get the pill, get the medicine completely free of charge. So one way or another, thank God, we're able to deliver what we need to give to the patients, regardless of insurance. When they don't have insurance, sometimes it takes a little longer because of all the paperwork involved, but ultimately they will get the same medicine, and they will get the same care. We will see them in the same facility. We will get blood work on them like we get for every patient. You will never be able to tell the difference in our office who has insurance, who doesn't have insurance.
And what about, do they need to wait long, and can it be like you wait long and next too late?
Yeah, so for cancer, we take it very seriously. If a doctor calls me up and says, I have a patient that I just found, I did a scan and I just found cancer. I don't know what it is, but the patient's very worried and they don't know what's going on. We will do our best to get them in many times that very same day, because that is not something you want anyone to deal with in their mind, because the mind is going to think the worst thoughts for any longer than they need to. You need to help bring them some clarity and give them some understanding of what's going on. So we will definitely see them within the same week, but we try to even get them in the same day in those situations where a new diagnosis is happening. And then depending on the diagnosis, we will see them every week or every few weeks to give them their therapy.
Because in Russia we have a kind of line for surgery for this case, and sometimes you need to wait for this like few weeks, and it can be a problem when it's too late.
And it creates a lot of anxiety. Few weeks, many times, I don't worry, but there are certain situations I've heard where sometimes if it's a complicated surgery that needs a very specialist surgeon, it could take months. That's too much. For cancer, you cannot wait too long. A few days, a week, 2 weeks even, may not make a big difference, but we do our best to get things going as quickly as we can.